So people ask me sometimes, Paul, why do you talk about Medicare one day, caregiving the next, and senior living after that? And I understand the question, but here's what I've learned after working with families for more than 20 years. These aren't three different subjects. They're all part of the same journey. And if you're helping someone you love who's aging, you're probably going to run into all of them. So today I wanted to explain why we talk about these three things, how they connect, and what you can do when you find yourself somewhere in the middle of it. But before we go any further, I just wanted to give a big thank you to all my subscribers. We've now hit over 10,000 in this brand new community, and I can't tell you how much that means to me. For those of you who don't know me, my name is Paul Copeland, and I'm a certified dementia practitioner and a certified senior advisor. I have more than 20 years of Medicare experience, and I own Care Patrol of Oklahoma City, where we help families find independent living, assisted living, and memory care at no cost to the family. Why crossover matters. Let me start with a question. If I were to have you close your eyes and describe a caregiver, I bet we'd all picture pretty close to the same image. It would probably be a daughter, right? But here's something you may not know. About 38% of family caregivers are men. That means there's a whole lot of dads, husbands, brothers, and sons taking care of people they love. And here's another thing that's pretty unbelievable. There are more than 5 million young people under the age of 18 who may be providing care for an aging adult or an adult with a disability. Just children, really. Think about that for a minute. So when I say family caregiver, we're talking about a much bigger group of people than most of us picture. And that's one reason seemingly different fields overlap, because caregiving doesn't have one face, it doesn't have one age, and it certainly doesn't happen in just one situation. Here's an example. Now let's imagine mom is 78 years old. She's beginning to have some problems managing her medication. Maybe she's fallen. Maybe she's forgotten appointments. Maybe she has trouble getting dressed. Maybe she's starting to show signs of dementia. At first, you may think we need to figure out what's wrong. So you go to the doctor, right? That's healthcare. Then somebody says, what does mom's Medicare coverage? Well, now we're talking about Medicare. Then you realize mom needs help every day. Now we're talking about caregiving. And eventually, you may find yourself asking, can mom safely stay at home? Well, now we're talking about home care, assisted living, or memory care. See what's happening? One problem leads to another question. And that's exactly why I don't believe families should have to navigate these subjects separately. So how does it actually work? Here's the way I want you to think about it. Something changes. Maybe mom falls. Maybe dad starts forgetting things. Maybe someone receives a new diagnosis. Maybe you suddenly realize, I can't keep doing everything myself. That's the beginning. Then we ask, what changed? Is it primarily a medical issue? If it is, we start looking at healthcare and Medicare. Is it a daily living issue? Now we're talking about caregiving and support. Has a parent's care needs changed enough that home may no longer be safe? Now we're talking about senior living, and sometimes it's all three. That's the crossover. And this is where the first step comes in. One of the biggest mistakes families make is thinking they have to solve everything at once. You don't. I've sat across the table from families who were facing what seemed like an impossible situation. And sometimes I had to remind myself of something. I don't have to solve the whole problem today. I just have to help them find the first step. That's what the first step is about. Not giving you thousands of things to do, not overwhelming you with information, but helping you understand where you are, and then helping you figure out what comes next. And here's what's coming next for us. Coming soon, we're launching the First Step website. It's going to be a special place where you'll find information, connection, and empowerment. A place where you can come when you're not even sure what questions you're supposed to be asking. We're really excited about this. Now, some questions I hear all the time. Let's answer a few basic questions. So number one, does Medicare pay for assisted living? The answer is generally no. Medicare is health insurance. Assisted living is primarily a housing and care decision. But I want to stress, understanding what Medicare can and can't do makes a huge impact on the decisions you make. Number two, how do I know when mom needs more help? I would say, look at what's happening in her everyday life. Is she falling, missing medications, forgetting to eat, getting lost, having trouble bathing or dressing? Are you spending more and more time trying to make sure she's safe? Those aren't just things that are happening, they're clues. Number three, does having a Medicare Advantage mean Medicare pays for mom's care? Well, not necessarily. Medicare Part C is a part of Medicare, but Medicare is not the primary. Whatever company has entered into the contract with Medicare is a primary, like a United Health or a Humana, a company like that. Number four, where do I start? That's probably the most important question of all. The answer is simple. Start with what's happening today. Don't try to solve the next 5 years. What's the problem you're facing right now? Understand what's happening. Understand your options. Then take the next first step. What's our bigger mission? And this is really the mission behind everything we're building here. I want this to be a place where families can come when they're confused, when they don't know what questions to ask, and find a place to begin. Now, we're going to talk about Medicare. We're going to talk about caregiving. We're going to talk about dementia. We're going to talk about senior living. We're going to talk about the emotional side of this journey too, because families don't experience aging in categories. They experience it as life. And when something changes, they need someone to help them understand what happens next. As far as the Q&A goes, let me talk about your questions. And that's where I want to end this video. I want to hear from you. What questions are you trying to answer right now? Is it Medicare? Is it caregiving? Is it dementia or senior living? Or is it something completely different? Put your question in the comments below, because your question may be the question another family didn't think about asking. And I'm going to use your questions to help build future videos and resources here. So like this video and subscribe to the channel, be the 10,001st person, and leave your questions in the comments. And if you're a family caregiver, I've also created a free resource called the Family Caregiver Survival Guide. You can get your free copy using the link below. We're building something bigger than a YouTube channel. We're building a place where families can come for information, connection, and empowerment, where you don't have to know exactly what you need before you arrive. You just need to know how to take the first step, because Medicare, caregiving, dementia, and senior living aren't separate subjects. They all cross over, and that's why we're here. And remember, you don't have to face this alone. We can take that first step together.